This video is designed to help patients in Saskatchewan learn about the important things they need to know before and after a total joint replacement. The video lessons and steps outlined by the Saskatchewan Hip and Knee Pathway are designed to help patients through the process of the surgery and onto a healthy recovery. In this module, you will get an overview of post-surgery care, important breathing and circulation exercises, post-surgery exercises, and important hazards you can avoid.
After the surgery, when you first see your hip, there will be a dressing on the hip and quite a large bandage over it. The nurses, when you're on the ward, they will be checking the bandage daily. They will be changing it as required.
So when you have your hip surgery done, we're going to be checking your dressing. We'll check your swelling and your circulation, and we'll check your whole leg to make sure that leg is getting adequate circulation. One thing will be important when we have you turning from side to side, we'll probably have a pillow in between your legs because we don't want you to cross your legs. We want to keep that hip in good alignment. We would want you to ask us to help, have help when you do turn from side to side. You may have oxygen tubing on when you come back from surgery. You may or may not have a catheter in your bladder. This would be removed when you're more mobile and able to get up to the washroom. Your pain is also going to be monitored by nursing staff. We will ask you to describe to us what your pain level is on a scale of 0 to 10. And 0 will be no pain, and 10 is the worst possible pain ever. It's important that you take your pain medication quite regularly as well, because everything that you do as far as your therapy and your mobilization and your activity is dependent on making sure that you're as little pain as possible. You will rehab much better if we can control your pain.
Some people will have staples and some people will have dissolvable stitches. People who have staples will be told to contact either their local doctor or the nurse to have the staples removed, usually at about anywhere from 10 to 14 days. The ward will provide you with really clear explanation and how to look after the incision when you go home.
And rest and sleep is very important in your post-op period. It's important that you can limit your visitors to so that you can get your adequate rest.
After a hip surgery, there may be some swelling in the lower leg. Often we do not see a lot of swelling after a total hip replacement, but it's always important that if there is swelling in the leg, that you elevate it. So that involves lying on the bed, resting the leg on about 4 or 5 pillows so that the knee and ankle are higher than the heart. And you want to stay in that position for about 15 to 20 minutes and do that as you need to throughout the day.
So let's just review some of those exercises that it's so important that you do. So can you show me how you're going to do your foot pump exercises? Up and down with your feet, excellent. And how often do you think we're going to do those? What did we ask you to?
Hour.
That's very good.
Pumping your ankle up and down at least 10 times, and then tightening the muscles on the back of your knee, so kind of pushing your knee down into the bed and tightening the muscles in your bottom, so squeezing your bum together. And you want to make sure you're doing those every hour that you're awake, at least 10 at every spot in the lower extremity, and that helps just to prevent blood clots in the leg. For the lungs, we work on deep breathing, so you want to make sure that every hour you're taking at least 10 deep breaths. So you're taking a deep breath in through your nose and then trying to take little sniffs on top of that to really fill up your lungs. And then to actually cough a couple times after you do that, just to maintain the health of your lungs.
This is to ensure that you get lots of air into your lungs after your surgery, because you won't be quite as mobile as you were before. So what we're going to make sure you do is you get a good expansion of your chest here. So you're going to try to breathe from here. Take a deep breath in, sniff. Hold that for 3 to 5 seconds and relax. Certain precautions for your hip following your surgery. One of them will be, do not bend your hip past 90 degrees. If you're sitting in a chair, do not reach forward to try and pick something up. We do not want to bend our hip past 90 degrees. If you're sitting in the chair, do not put your feet up on an ottoman or a stool because we don't want to bend our hips past 90 degrees. So further precautions for your hip following your surgery would be to not cross your legs. In sitting, do not cross your legs at the knee, or do not cross your legs at the ankles. This can also be true in lying. Do not cross your legs one over the other as you're lying. So the precaution is to ensure that you do not cross your legs.